I was tempted to give up. How can anybody say anything with respect to that? But what I'm going to do is to ask, and I'll consider it a victory if one of you votes against this proposition. And given the enormous push in this group for accreditation, and given the desire for conformity in this group, it's a hard row to go. I thought about the arguments that I might marshal, and I thought it would be unfair to raise the question of who exactly are the accreditors and how did they get to be chosen. That to suggest that it might be because they had political connections, or because they knew the Minister of Health, or because they went to the same university as one of the people who's making the choice. I think that's unfair to even bring up. But I think there are really three arguments that I think really are true. And I need to say, by way of self-disclosure, that I am both, like many of you, a member of the hunted as well as hunters. I have been a part of those pack of humans that come hunting institutions. And over the last year, I've been in the liaison committee of medical education, and I've been doing those reviews for a number of years. The first issue is the regulatory burden. As the Dean of Education at UNC, we did our review through medicine 3 years ago. 2,500 pages, thousands of hours of faculty and staff spent in the accreditation process. That is time that could have been spent in creating interprofessional education, in evaluating education, and it was wasted. Is that a good use of our time? The second issue has to do with what the intent is. We understand that the core of accreditation is regulation. It's regulating the bottom. In medicine, I suspect many of your disciplines, almost every standard has in parentheses after it the school in which caused the standard, okay, over time. And they've accumulated over time, like barnacles on a ship. It's a regulatory burden, and it throttles innovation, as we almost clearly demonstrated in the debate right before this. And really, the third issue is outcomes. And I was charmed to hear my colleague raise the example of Flexner, which is the granddaddy of accreditation processes. And I think all of you know the premise here, that Flexner, building on the experience of Johns Hopkins and Michigan and others, put in place a set of standards that the elite schools in the United States thought was important. And I think we'd all agree that it's useful to have medical education a part of universities, and that there be some science component, et cetera. And I think we all understand what happened post-Flexner, that 135 medical schools dwindled to 88 in 10 years. But what isn't often mentioned is what are the other consequences of Flexner, so that an entire generations of schools put together by and for African Americans, by and for women, died. And their voice was quieted for 2.5 generations. Is that really what we want moving forward? I ask you for your vote.